Hey, y'all, Gary with Tennessee Stands. Hey, so here's the deal. I want to come to you right now with another update. We've been following closely baby August Stoll, who right now is fighting for his life at Vanderbilt Children's Medical Center here in Nashville, Tennessee. I want to get to some details about this thing because there's some information that you need to know just as the general public in terms of what you're being told, statements being made by Vanderbilt Health, but the truth that's happening behind the scenes, and additionally how we completely failed to protect this family for 2 years now in our efforts to secure our rights here in Tennessee. But before I get to all of that, because I want to make sure that we get to this first so that you hear it, some of you don't make it all the way to the end of these videos, which is fine. The family has 3 major needs right now, and we want to communicate that. Look, number one, the family needs money. They need money. This is going to be expensive. They're having to go sort of outside the bounds outside of the boundaries as you can imagine of typical protocol because they're having to work against a tyrannical doctor, which we'll get to in a moment. So we're having to find some alternative methods to get help for baby August. And as you can imagine, that's going to come with some extra expense. So you can go to givesendgo.com/fightforaugust. That's givesendgo.com/fightforaugust. And I encourage you to go there. That donation portal has been set up directly by the family. It is going directly to the family. And we encourage everyone that follows Tennessee Stands, please go and help to support this family. The other thing they need, if anyone in our network has this, they need a place to stay. The family needs a place to stay that is near Vanderbilt right here in Nashville. And I believe they have a place to stay right now, but that's temporary. As you can imagine, with how things are going to go, possibly, hopefully, we're prayerful that things will move forward with a transplant. And depending upon that, and then, of course, a period of recovery, as you can imagine, the family is going to need an extended place to stay. And so if anyone has a home or any sort of situation that you can offer the family for August, that would be much appreciated. You can email us at info@tennesseestands.org, info@tennesseestands.org, and we will make that connection to the family. The last thing is, looks like they need a doctor. This doctor isn't going to do it. I would imagine by now, with everything that's happened, that they probably would not want this doctor that they've been working with to perform this procedure. I'm only conjecturing. I probably wouldn't if I were the parent. So the family is looking for a doctor that will do this procedure for August. That is a doctor that either can quickly get, or currently has admitting privileges to Vanderbilt Hospital to do this cardiac procedure on the baby. So I'm not sure how all of that works, but just putting the ask out there. And so doctors across the United States, if you can provide help here and save this baby's life, there's an opportunity to do something here. So please connect with us. Again, email or contact Vanderbilt Health. All right, but let's get to some details now. Vanderbilt just put out a statement today, and I can tell you with certainty they're feeling the heat. We know they're feeling the heat. And good for them, because they should be feeling the heat while this child is on his deathbed, just needs a heart. They do this all the time, and currently refusing because the family does not want to give August a full swath of vaccines, as he's only 7 months old and currently in dire straits with a heart that's barely keeping him alive. And so Vanderbilt puts out this statement today that, is very misleading to the public because they're trying to make this about COVID. And I want to be clear, this has nothing to do with COVID. This has nothing to do with the fact that August is immunocompromised. So here's the statement from Vanderbilt. When evaluating transplantation as a suitable therapy for adults and children, VUMC is obligated to consider factors that affect the patient's risk of death following transplant. For most transplant programs in the U.S., including VUMC, it is standard of care to protect the life and health of our vulnerable and immunocompromised transplant patients by reviewing immunity against common infections, including the flu and hepatitis B. While we strongly recommend COVID-19 vaccinations, patients at VUMC are not required to receive the COVID-19 vaccination as a condition of participating in the organ transplant evaluation process. Now, here's the thing about that. They're trying to make this about COVID, trying to say, we don't require that much. But the truth is, which is why we put out Hannah Stoll, the mother. It's why we put out her statement at TennesseeStands.org, because we're trying to, these are not good guys, okay? This doctor has been fighting this family tooth and nail, not about the COVID vaccine, not about the flu vaccine that they're mentioning here, about all sorts of vaccines. MMR, the whole 9 yards. They want him to take a whole swath of vaccines. There are vaccines that are required by the state. There's a schedule from ages 0 to 2, and I can't remember the number because it's constantly changing. But at this point in state law and requirements across the country, children ages 0 to 2 get somewhere in the neighborhood of about 72 doses or more of vaccinations. And I believe at 7 months, I went back and looked at the numbers. Don't quote me on this, but plus or minus, August would require 16 doses of vaccine to get him up to date according to the current vaccination schedule. Now, I don't really care why August is unvaccinated and whether or not his parents chose that for medical reasons, reasons of conscience, or religious reasons. It really doesn't matter. The fact is the family has opted not to have their child vaccinated, and that should be up to the family. And so in Ms. Stoll's statement, and I'll take you there, she says this to dispel the myths that Vanderbilt is just, trying to make these small requirements on the family. Very long story short, the transplant team, specifically Dr. David Burrell, gave us an ultimatum that if we did not give August a series of vaccines, he would keep him off the transplant list. He specifically used the phrase, quote, "I am mandating," about 8 times during our first conversation about this. The second conversation, I reasoned and debated with him over the insanity of giving my baby vaccines with a huge risk of a negative outcome on a severely immunosuppressed child on their deathbed. He continued to refuse. I asked him if this was legal. He said no, meaning does this have to deal with any legalities? He said no. I asked if this was policy. He said no. Our third conversation this morning, I believe this was yesterday, he came and asked me if I had any more questions. I asked if he had changed his mind. He said no. So the bottom line is you have a hospital that is protecting a doctor who simply for his own philosophical reasons wants this baby to receive a series of vaccinations before he is going to do a heart transplant. And per his statement, has nothing to do with policy, has nothing to do with law. And the hospital is protecting this doctor's apparent right to keep a baby on his deathbed and remove the right of a family to determine the own medical care for their child. And so while Vanderbilt is taking all the heat, they're putting out all this messaging about COVID-19. This has nothing to do with COVID-19. This also has nothing to do with the fact that Vanderbilt has a responsibility to make sure that the child has a good immunoresponse to the transplant. The vaccines being required on August has really nothing to do with immunity. The doctor simply wants the baby vaccinated. Why? I don't know. You'd have to go ask Dr. Burrell. But then you follow this up with an article from the Epoch Times, which is nothing more than a puff piece to mention the name of Senator Jack Johnson. And here's what these folks have to say, and this is where I want to get into what we've been fighting for the last 2 years, and specifically why August Stoll is laying on a deathbed right now at Vanderbilt Hospital. So Jack Johnson somehow gets involved. Well, I can tell you why he's involved. He's involved because he's running for re-election. And never in the past 2 years has the majority leader of our state Senate ever been concerned about anyone's right to make their own decisions over vaccination, especially in healthcare. Never. Never been concerned. All of a sudden, the Epic Times is now interviewing this senator out of the blue about a bill he ran this year that keeps COVID patients from being refused, or keeps patients from being refused transplants based on a COVID vaccine. And here's the bill. This was Senate Bill 568. And this bill does one thing and one thing only. A covered entity, which is a hospital in Title 68, a covered entity shall not, solely on the basis of whether an individual has received or will receive a COVID-19 vaccine, do the following. Number one, consider an individual ineligible for transplantation or receipt of an anatomical gift. And it moves on about evaluation, surgery, and counseling. So this bill did absolutely one thing and one thing only. It kept hospitals from denying transplants to patients based on a COVID-19 vaccine. Now, there was a reason that this bill was passed. And by the way, this was not Senator Johnson's bill. This bill was run by Majority Leader Johnson in the Senate and Majority Leader Lamberth in the House. When you see Johnson and Lamberth run a bill, that means one thing. That means that it was the governor's bill. So this was the governor's proposed bill to get a win, to take political pressure off of him to fix this. And here's why. The reason that bill was passed is because last year we found out the story, and this was happening across the country, but here in Tennessee, story of a 26-year-old woman who needed a kidney transplant. She had a brother. Her brother was a matched donor willing to give his sister his kidney. So the surgery did not even require this 26-year-old woman to go on the donor list. The brother was already matched, and he was willing to give up his kidney. All Vanderbilt, back to Vanderbilt, had to do was do the procedure. They refused to do this life-saving procedure on this 26-year-old woman because she refused to get a vaccination for COVID-19. Thankfully for her, she was able to be transferred to Knoxville, and they did the transplant in Knoxville. But subsequently, because of this issue and because of the political pressure put on the governor, the legislature passed a bill that solved only that one problem. So, as we've been trying to protect liberty and the rights to make our own medical decisions, the legislature usually only wants to do one thing. They just want to carve out the thing that they're currently getting political pressure on. So they passed a bill that simply stated hospitals must give a transplant regardless of COVID-19 vaccination status. But here's where the puff piece is really offensive in terms of the Epic Times. And frankly, shame on the Epic Times for printing this. They need to go take a little bit of a law lesson before they print nonsense like this. They say Johnson, who spearheaded legislation earlier this year outlawing hospitals from denying organ transplants to patients without COVID vaccines, also emphasized that there is no law in Tennessee that legally requires children to be vaccinated in order to receive medical care. Follow me here. So Johnson's excuse, his statement for what's happening is that, well, this is not the legislature's fault. The state legislature bears no blame for not protecting liberty because the state legislature never gave permission to the hospital to do this. All right, so Senator Johnson, let me explain to you how lawmaking works, even though you've been supposedly doing this for 16 years now. Law is restrictive, not permissive. If a state law does not keep someone from doing something, then that action is permissible by law. If it's not protected or outlawed by our Constitution. So if the state legislature is not willing to step up and pass a law to restrict activity that would defend the liberty of individuals across the state, then others have the permission to do things. In other words, if I want to go out somewhere and exercise my right to do something, and there is no law against anything that I want to do, well, then it's permissible for me to do it. If the law doesn't address something, I don't need to go to the government and get permission to do something. I just do it. Now, when a law is made that says I can't do something, then I can't do it. So that's how law works. So, sir, let me make sure you understand this. As long as we have not passed a law that does not inform Vanderbilt that they cannot discriminate against patients because of their vaccination status, then guess what they can do? They can discriminate against patients based on their vaccination status, and they do not need your permission to do so. It is not required that the legislature pass a law giving them permission to discriminate. So, Tennessee, here's the problem. And this is why I'm so incredibly frustrated with what this family is having to deal with. And I hope that you hear me and you understand what I'm saying. For 2 years, in 2021 and in 2022, in 2 legislative sessions, we have worked, and Tennesseans have sent floods of emails. We have held rallies. We have made phone calls, and we have drafted bills that simply had one aim, which Montana did last year, to prevent discrimination on vaccination status, whether it be in employment, whether it be at the grocery store, or whether it be in healthcare. Because if we don't act to secure the rights of individuals to determine whether or not they want to be vaccinated for anything, then discriminatory acts like this will continue. And I got an opportunity to be on the Todd Starnes radio show yesterday, and I appreciate that. And one of the messages that I put forward is that fighting for liberty is not just about fighting for your right to do something. It's not just about fighting for freedom and fighting for everyone to have a choice. That's a part of it. But sometimes fighting to secure individual liberties is literally a matter of life and death. And as we fought for this over 2 years on these 2 separate bills, I also want to make sure that every Tennessean hears me. The governor's office, the governor himself, sent a direct representative into those committees to testify against those bills. Let me say that plainly. The 2 bills that we ran in our legislature for the past 2 years that had one aim: to secure an individual's right to not be discriminated against because of their vaccination status, to protect August Stoll, to give his family the right to go to a hospital and expect that the doctors would act to save their baby's life, regardless if he was vaccinated. On 2 occasions, the governor sent his direct legislative liaison to testify against the bill and communicate that the governor's office did not support these efforts. You have Tennessee, a supermajority Republican legislature and a Republican governor that has publicly stated and acted on more than one occasion to deny these rights to individuals, and that is why we sit here today. So here's the thing. I pray to God. We are praying. We are doing everything we can to continue to put the message out, to help this family, and to see that baby August survives this fiasco. There's no other way to put it. But here's the thing. We are going to put this forward next year. We are going to once again submit legislation in 2023 that is going to secure the rights of individuals to make their own medical decisions. And God help us if after seeing what the actual outcome of their inaction is, the possible death of an infant, because you're allowing tyrannical cultists who would prefer seeing a baby dead than just simply helping a baby live because of his vaccination status, because he's a subpar human being now. There's certain rights that August does not deserve now. He does not have a fully expressed, constitutionally secured right to life and liberty because he's unvaccinated. I'm pleading with Tennessee. I'm pleading with every elected official and everyone running for office that in 2023, when we go back into session, that you help us change this so that we don't have to have these conversations anymore, and that families can have and individuals can have an expectation that their rights will be protected by state law, that state law will restrict the actions of others from having the ability to steal the liberties of people who simply have an interest in their own medical care. Thanks for watching. Please continue to pray for the Stoll family. And again, as we stated earlier, do everything you can do to support this family. If you can give, if you can help find a place to stay. We're just making a call. Any doctor within the sound of my voice that can come to Vanderbilt and help save this baby's life, we're asking you to come. You have a duty. You have a duty to do so. You have a prescribed duty to do so.